Uh, uh, Hello, good morning. My topic is therapeutic hypothermia in deceased organ donors and kidney graft function. First, the definition. Therapeutic hypothermia, also termed targeted temperature management, is an established intervention that is used to protect neurologic function in patients with certain types of cardiac arrest, stroke, and asphyxia. The effect of therapeutic hypothermia on renal protection is uncertain.
After kidney transplantation, delayed graft function, defined by the need for dialysis within 7 days after transplantation, affects up to 50% of renal allografts obtained from deceased donors. While therapeutic hypothermia is an established intervention used to protect neurologic function in patients with certain types of cardiac arrest, the benefits of hypothermia for renal protection have remained uncertain. To investigate the role of therapeutic hypothermia in this setting, the authors randomly assigned organ donors after neurologic determination of death to one of two targeted temperatures, 34 to 35 degrees Celsius, the hypothermia arm, or 36.5 to 37.5 degrees Celsius, the normothermia arm. Temperature protocols were initiated soon after donation was authorized and ended when organ donors left the intensive care unit for organ recovery in the operating room. During the trial, 572 patients received a kidney transplant. Delayed graft function developed in 39% of those in the normothermia group as compared with 28% of those in the hypothermia group. The study was terminated early after a pre-planned interim analysis showed that hypothermia was associated with a significant benefit. This trial demonstrates that inducing mild hypothermia in deceased donors before organ recovery lowers the rate of delayed graft function in recipients. Full trial results are available at nejm.org.
Application in medicine. Delayed graft function, which is defined as the requirement for dialysis in the recipient within 7 days after renal transplantation, results in increased health care expenditures and decreased long-term graft function. Delayed graft function is reported in up to 15% of renal allograft recovered from donors after declaration of death according to neurologic criteria.
What is therapeutic hypothermia? You're watching this video because your baby needs therapeutic hypothermia, which is also commonly called cooling. Thanks to medical research, we know that cooling your baby by 3 degrees for 3 days can improve your baby's outcomes and protect your baby's developing brain. There are lots of reasons why babies need to receive therapeutic cooling. Your baby will be cooled using a cooling blanket and will be asleep throughout the entire process. The technology and the equipment in the neonatal intensive care unit can seem super scary, especially when your baby is so small. So it's really important to remember that your precious baby will receive expert intensive care and medication. The team will make sure your baby remains comfortable while receiving the cooling therapy, which offers neuroprotection, leading to less neurodisability and better long-term neurodevelopmental outcomes for your baby.
Pros and cons. Pros: the primary outcome, delayed graft function. The recipient requirement of dialysis during the first week after transplantation was determined for each kidney recipient at the center where the organ was transplanted. Cons. Current protocols stipulate that normothermia, which frequently require active warming, be maintained in organ donors. The effect of targeted hypothermia as an intervention to protect renal function during the donation process in uncertain.
Hello. Today I've been reading a paper from Bromberg and colleagues published in Transplantation. This is a multi-center RCT from the USA with some quite interesting results. The study drug was ANG3777, and this is a hepatocyte growth factor mimetic. It was administered randomized against placebo to renal transplant recipients with either a low urine output postoperatively or a serum creatinine that was not reducing at a required rate. It's a good quality, double-blind randomized study with the control arm receiving saline infusions as placebo at the same time points as the study arm. The study drug was associated with an increase in urine output over the month of follow-up, reduced dialysis sessions, and reduced hospital stay compared to the control arm. Also, the study group was found to have better serum creatinine at multiple follow-up time points and better graft survival, although it is a small study of only 28 patients. The study was actually halted early by the FDA because of the significant efficacy findings, and a phase 3 study has been initiated. I think this shows very interesting results, but actually only 19 patients received the study drug in this trial. So I'm really looking forward to seeing what is shown by the phase 3 study. Thank you for listening. Let us know if you have any comments.
Issue update in Ecuador. Ischemic reperfusion injury during the transplantation process is a major contributing factor in Ecuador to subsequent poor allograft function. As such, current interventional post-transplantation trials cannot prevent the injury itself, but instead attempt to ameliorate it. Such an approach may be less successful in organs from expanded criteria donors, which already have an increasing rise of poor post-transplantation functioning owing to chronic disease in the donor.
At 31 years old, Ryan Swanek was living life to the fullest.
He had a life that most people dream about. I mean, he traveled all over, he skydived, he rock climbed.
But in July of 2016, Ryan's life was cut short. While skateboarding in a park in Waukesha County, he fell and severed his spinal cord.
There was absolutely no brain activity. They said that he was dead.
His mom, Kim, told her son goodbye.
It was the hardest thing I've ever done in my life.
Not long after Ryan's death, Giovanni Tyers got the phone call from Frederick Hospital that he'd been waiting on for 8 years.
They have a kidney here at Frederick, and they want me to come in.
Tyers is one of 5 people who received an organ transplant from Ryan.
The gratitude that they show towards receiving these gifts is a gift to us in itself.
On the 1-year anniversary of receiving his gift, Tyers got this tattoo.
Tying up my life, him adding life to it.
Months later, when Tyers finally met Kim, he noticed a similar tattoo over her heart.
The nurse came up to me and she gave me a readout of his heartbeat. And she said, here's his last readout. I thought you would like to have that.
Oh my God, we have the same tattoo basically.
A mother who has lost so much.
Funny how we both had like the same mind frame on let's get this whole heartbeat or lifeline type deal.
Now has a new family member and a bond that can never be broken. In Wauwatosa, Tim Elliott, WISN 12 News.
Finally, conclusion. Mild hypothermia has compared with normothermia in organs donors after declaration of death according to neurologic criteria significantly reduced the rate of delayed graft function among recipients.
if your brain is not getting oxygen, your heart's not beating, you are essentially no longer alive. And without intervention, you would definitely not survive. Aggressive CPR and ice is what brings them back to life. The body and the brain almost attacks itself, and it becomes a worthless organ. And so our goal is to say by slowing down the metabolism, by taking the body down to really cold temperatures, we can prevent the body from doing that. Hypothermia also decreases the size of heart attacks. So even these patients, many of them are having heart attacks. That's what caused them to go into cardiac arrest in the first place. We know that by chilling them and cooling them, we're also minimizing the size of the heart attack itself. Rather than be a massive heart attack, maybe we can keep it down to being a submassive or a smaller heart attack. If you come in that state, while before we would say it's 5% chance you'd survive, less than 5% chance that you're going to have neurologic intact, now we could say if you've